I am wearing a scrub suit for this video.
What's up, guys? It's the Fiona.
I'm actually gonna be heading to school for our first clinical rotation for this semester, and I think I'm running out of time. It's very windy out here. I hope that my audio is fine. Okay. If you have been watching my videos, for sure you know that we have finally started our face-to-face classes. I actually made a university vlog, which was the previous video that I uploaded. You can go ahead and click this icon right here so you could watch that. Alright, so after how many weeks of processing some documents, we have finally resumed with our clinical rotations. It is the most exciting part of nursing school, in my opinion, because we get to go to the hospital and apply what we have learned from our lectures. Clinical rotations, or in my school, it is what we call as RLE, or Return of Learning Experience. It's basically when we go to hospitals as well as communities, which is required for our community health nursing subject. When we go to hospitals and go to the communities, we apply what we have learned during our lectures, like taking the vital signs of a patient as well as administer vaccinations and all other nursing skills that we have learned. Clinical rotations usually start during the second year of nursing school, after your capping and pinning ceremony. So without further ado, number 1, create a structure when taking vital signs. I was too confident at first, but when I was in front of the patient, my brain couldn't work properly, because usually you need to work fast but as efficient as possible. You could practice taking the temperature while you assess for the pulse rate and the respiratory rate, and after that's done, you could proceed on taking the blood pressure as well as the O2 saturation. Practice this while you're at home. I don't want you to experience what I just experienced, but I did pretty good. The patient was very nice, actually. She's very patient because she's a patient. Okay, never mind. Number 2, think of how you'll approach your patient. This might sound silly because a lot of people look natural when approaching a patient, but to some people, it's very difficult to do. Maybe they're an introvert or they're just not used to interacting with people. But that's okay. I've met a lot of registered nurses who said that they were very shy when they entered nursing school. Even some of my classmates told me they're just so shy. But right now, they're very good at it, and most of them are loving the experience. It could be as simple as greeting them a good morning, a good afternoon, or a good evening. After that, you could ask for their name and ask them what they're feeling, how they are. Ask them if you could take their vital signs. It is important because some do not want to have their vital signs taken during that time because maybe they're tired or they're doing something. So ask that first before just putting a BB cuff into their arms and just doing whatever you want. Remember to always establish rapport to make your patient comfortable when they're around you. Okay, moving on to number 3. Woo, I think I'm nailing it. I still have 30 minutes before call time, so we got this. Number 3, try to resolve conflicts as soon as possible. Since you will be assigned with your RLA group mates, I'm saying this because I have observed some groups have conflicts. Sometimes they fail to resolve their problem. So if you have problems within your group, communicate with them and tell them what your concerns are as soon as possible. Like, the dream won't work if the team don't work. Oh, and by the way, we can't just ask our professors or clinical instructors to place us in another group. That's why you'll be spending most of your time with your RLE group mates. Even during lectures, there are times when our professors would ask us to be placed according to our RLE group. Number 4, don't be afraid to ask. If you are unsure of something, always ask your clinical instructor. From my experience, all my clinical instructors are just so kind and so understanding. They're very patient when it comes to guiding us into doing a certain nursing skill. If your clinical instructor is a bit strict, still have that courage to ask them. If you get yelled at, then fine. At least you will learn after that. It's just asking. You'll never know the answer if you keep your questions to yourself. Number 5, volunteer. Yes, I'm talking about when your clinical instructor would ask who would like to perform a certain nursing skill. Don't be shy. just volunteer. Take all the experience that you could get out of that day. But of course, if you have already performed that skill, maybe some of your group mates would want to perform that instead. Let's give others a chance. They're going to be future nurses too. I know it can be scary, especially when the procedure could hurt the patient, but your clinical instructor will brief you before you actually do that skill. They will not just ask you and expect you to do things on your own. They will be there, they will be beside you, watching you, guiding you. If they forget to do this, be the one to ask. That's all from me. If you have other suggestions for our future nursing students, then go ahead and comment down below. And to all nursing students out there, just remember, be confident, but don't be overly confident to the point where you think that you're always right. Be open to criticism and use those to improve your skills. If you haven't yet, please subscribe to my YouTube channel and click the notification bell to keep you updated when I post new videos weekly. Lots of love! Bye!